Dr. Paul, why test the gut first? Why is it so important?
Look, I mean, what's the root cause of every single chronic disease? Inflammation. What regulates the inflammatory response? The immune system. And where does most of the immune system live? In the gut. 70 to 80% of your immune system's in your gut. So that's why we always look at the gut, pretty much no matter what, someone comes in with, pretty much mandatory stool tests, right? Very few exceptions to that rule.
In our gut, there is good bacteria and then there is bad bacteria. Is there a third kind? What actually is living in our gut?
There's good bacteria, and then there's pathogenic bacteria, and then there's dysbiotic bacteria. Probiotics are kind of like your beneficial bacteria. They're called keystone commensal probiotics, these kind of bacteria that are your lactobacillus, your bifidobacterium. Those are your healthy bugs. They make up a vast majority of your microbiome. When it comes to bad bugs, now pathogenic bugs are the ones that E. coli, Salmonella, C. diff, Giardia. These are ones that are kind of cause more acute issues, right? Like you get food poisoning, you go travel and you get exposed to contaminated water, diarrhea, abdominal pain, vomiting. Those are your pathogenic bugs. But the ones in a chronic setting, right, where we've had symptoms for a while, can't figure it out, we're getting testing done. The ones that can become harmful are dysbiotic bugs, which means they're okay if they're kept at a low amount, right? So, for example, Morganella, Pseudomonas, Klebsiella, these kind of bacteria, if you have minimal amounts of them, usually no problem as long as there's balance within the microbiome. But when these become overgrown, that's where we have issues, right? They're creating histamine and inflammation and all this, downstream inflammatory effects that can really affect the gut. Same thing with yeast and candida and parasites, right? Now, yeast, you can have a little bit. Parasites, there's argument then like, well, we don't really want any there. But, yeast, for sure, you can have a little bit of the yeast in the gut and not have much of a problem. But when yeast and candida and other forms of fungus become overgrown, then we got issues. And so it's all about, a balance within the gut.
Dr. Paul, this next one is a three-part question on gut inflammation. Number one, when someone comes to you and says, I have an inflamed gut, what is the first question you ask them? Number two, what triggers inflammation in the gut? What are the culprits? And number three, how do you handle an inflamed gut? What is your approach?
What does the person mean by inflammation? Is it bloating and indigestion? Is it actual pain? Like, what are they experiencing with the inflammation? There's mainly three categories that can trigger inflammation: food, microbial imbalance in the gut or infections, or toxins. Okay, so like infections, toxicity, and inflammation coming from our diet and in our what we drink. So we want to try to first remove inflammatory culprits, whether that's a food, right? Maybe it's something like removing yeast or bacterial overgrowth or parasites from the or H. pylori, or maybe adding something good back in to try to promote that healing. Maybe beneficial flora, like your good probiotics, maybe you're low on those, or maybe different nutrients that we're deficient in. But that's kind of how we try to regulate inflammation, right? Take away the players that are creating or triggering that inflammatory process, and then add back in the things that are maybe holding us back from that healing response.
This next one is a two-part question. The first is, why don't anti-inflammatory medications help everyone with their gut inflammation? They're anti-inflammatory and gut has inflammation. Why don't they work? And then the second is, are there specific markers to measure inflammation in our gut? Which ones are the markers you leverage and use on a daily basis?
Anti-inflammatories can block certain pathways and can kind of help the inflammatory process in that moment in time. But there's a lot of other things that can, it's not going to affect, dysbiosis in the right way. It's not going to impact, for example, motility. You hear a lot of patients say, like once they're constipated, right, discomfort happens much more frequently. And as they go and your bowel movements get more regular, their discomfort and their bloating and their gas and all that stuff a lot of the times gets better. Eating inflammatory foods, you're still doing stuff that's irritating, the gut, the gut lining. And you'd think that, anti-inflammatories would help that. But remember, anti-inflammatories block specific pathways. So if it's not blocking the specific pathway that's involved in your inflammation, then it might not be as helpful. We can test things like calprotectin. We can test things like lysozymes and things like lactoferrin, and that's inflammation in the gut. And we can also test things like secretory IgA. Secretory IgA is your immune system in your gut. It's your first line of defense. So this means, how is my immune system responding to my environment? Is it really, really high and trying to go after something and tell my body something like, look, we're trying to clear out this yeast or this candida or reacting to this food or this toxin in my environment? Or is it really, really low and now it's not mounting enough of an immune response because of chronic stress on the body over time? Poor diet over time, chronic stress, lack of sleep, work stressors, lack of exercise, lack of sunshine, whatever that looks like, that can put stress on the system. And now your immune system's downregulated and not helping you out enough. So there's different reasons, why you might still feel inflamed, even if you're taking anti-inflammatories.
How does the gut microbiome affect my brain health? Can it affect my mood? Can it affect my energy? What type of brain function does the gut microbiome affect?
90 to 95% of our serotonin's made in our gut, right? So if we have a negative effect from a toxin as in terms of how it's affecting the microbiome, that can affect our mood and our mental health and things like that. And also dopamine, other neurotransmitters are also made in the microbiome. So that's the biggest way that that would affect, the brain-gut axis or gut-brain axis, is how it affects neurotransmitter production because of the health of the microbiome. And short-chain fatty acids too, like butyrate, remember, is a really, really good nutrient fatty acid when it comes to brain health. And butyrate is what's called a postbiotic, right? So you have your prebiotics, which are like your fiber, and then you have your probiotics, and your probiotics ferment the fiber of the prebiotics, and they make postbiotics called butyrate. And that butyrate is something that's really, really helpful, for just overall, brain and neurological function as well.
Could environmental toxins be causing my unexplained digestive problems? There's a lot of literature out there now that talks about mold, heavy metals, certain chemicals like BPA, etc. Can you comment on that? And then the second piece is, how do you determine that someone actually needs to be tested for environmental toxins?
Environmental toxins, we do test now, things like mold, heavy metals, and environmental chemicals. They can definitely affect the gut. They can affect the intestinal barrier. They can cause IBS symptoms. They can even, contribute and trigger things like IBD, inflammatory bowel disease, like Crohn's disease, ulcerative colitis, those kind of things. BPA from plastic products, glyphosate from Roundup. The active ingredient Roundup is, it has a negative effect on the microbiome by kind of wiping out some of those good guys, promoting some of that dysbiosis too. So yes, environmental toxins can certainly affect gut health and the microbiome.
How do you determine that someone needs to be tested for environmental toxins?
Environmental toxins are a little bit trickier, right? Because everybody's kind of exposed to them, but are some people more exposed than others at a workplace where they live, at their office, those kind of things. So we have to kind of take a history and a deep dive to try to figure out, are we testing this person for environmental toxins? But, a classic one is, well, I feel so much better when I go on vacation, or my health issues all started when I moved into this home, or, like if I step away from work for a while, I feel better.
Here's a common question we get. Why do probiotics help some and not help others? The same question ties to nutritional supplements. A given nutritional supplement helped my friend, but when I took it, it made no difference for me. Why is that?
I have a notion in functional medicine when we're looking at the gut, we want to weed the garden before we seed the garden, right? We want to take away the things that aren't supposed to be there, right? The overgrowth of yeast and candida and parasites and H. pylori, those kind of things, and then kind of, seed the garden after it. Now, well, probiotics are really good, but do we want to take that at the beginning, at the end, right? The thing that's really important that's commonly missed is the order in which you do things. Now, there's exceptions to the rule here. Sometimes I do them simultaneously, but it just depends on the individual patient, which is why it's important, to consult with your individual functional medicine practitioner to try to figure out what's best for your individual plan.
Dr. Paul, what about nutritional supplements? What is the most common issue or problem you see when it comes to your patients when they're taking nutritional supplements?
Most of my patients are pretty knowledgeable with that, and they have been taking a lot of nutrients. The thing that they're usually missing, if they're just haven't been to a functional medicine provider, is the specific testing to try to figure out what they need, how long do they need it for, what forms, what kind of dose in terms of milligrams. Like that's the biggest thing I think people are missing, and then the order, and then trying to figure out the triggers, like what's the why. Like I could have for example, I could take all the supplements I wanted, which was me at one point, and I lived in a house that was full of mold. Well, I didn't feel any better, right? I was the same, even though I spent thousands of dollars, took hundreds of supplements, right? Didn't make any difference until I figured out, oh, I have mold in my house, I have toxicity, I got to remove that from my environment, clear it out of my body. Same thing goes for someone that has a really, really lousy diet and they're trying to out supplement in it. It's just not probably going to happen, right? You probably can't get around a really poor diet with supplements. It's just not likely to happen.
Let's talk microbiome testing. You had mentioned that a stool test is a must. Why is that? And then is there any other test that you really like for the microbiome?
Roughly 100 trillion bacteria live in the microbiome. And a stool test is a really good representation of the health of the microbiome because we want to understand, is it balanced? Do we have too little of the beneficial bacteria? Do we have H. pylori? Do we have too much yeast or fungus or candida? Do we have too many parasites present? Do we have too much inflammation in the gut? We can answer all these questions with a really high quality stool test. Another test for the microbiome is an organic acid test, which is a little bit more sensitive when it comes to things like yeast overgrowth, and it does also test for a couple metabolites when it comes to bacteria.
Here's a very common question that we get on SIBO, small intestinal bacterial overgrowth. I was diagnosed with SIBO. I took antibiotics. I went on the low FODMAP diet. It helped a little bit, but then my symptoms came back. Why do my symptoms keep coming back? What am I doing wrong? And what do you recommend?
So here is the thing I think happens the most. So let me paint a picture for you. You have a patient with low stomach acid, low digestive enzyme output, high amounts of stress, yeast overgrowth, and let's say low beneficial bacteria. If they have SIBO, which is small intestinal bacterial overgrowth, what they're mainly trying to do, right, is to target the bacteria, kill the bacteria, and then put you on this low FODMAP diet to just minimize your symptoms in the process, so you're not feeding the bugs what they want, and it usually helps reduce symptoms. Now, low FODMAP diet is not intended for long-term purposes either, but why would that patient maybe either not get better, or maybe why would their symptoms come back? Because you're only addressing the bacteria, right? You still probably have low stomach acid, low digestive enzyme output, candida overgrowth, right? Things like bacterial overgrowth, obviously, what you're treating with the SIBO. but then, low beneficial flora, whatever those findings are, the point is you're hitting 1 out of the 5, right? And so you still have a lot of these other things. You can throw food sensitivities in there too. And if say you're sensitive to some of the things on that low FODMAP food diet. So all these different factors can be things that can perpetuate and contribute to the same symptoms, the gas, the bloating, the constipation or the diarrhea. All these, common symptoms that you'll see with SIBO, they can be caused by any of those things that I just mentioned. And that's why just addressing one thing and one variable, that's why I think a lot of the symptoms return.
Dr. Paul, you see some of the most chronically ill patients in Minnesota. These are patients that have been dealing with constipation-like symptoms for years, IBS, IBD, ulcerative colitis, Crohn's, SIBO, recurrent SIBO, or just simple bloating. They could be having bloating for years that has progressively gotten worse. What do you say to these patients that's different from conventional medicine? How are you able to help them when conventional medicine can't? What's the reason for your success?
The biggest reason that we have success here is because we do thorough testing and try to figure out every different avenue that can affect gut function. So for example, if someone comes in with bloating, say I just do a stool test. Okay, well, sure, it can come from bacterial overgrowth, yeast overgrowth, parasitic overgrowth, low stomach acid, low digestive enzyme output, but it could come from chronic stress. It could come from food sensitivities, food allergies. All these different things can contribute to very similar symptoms. So if I'm just looking at one test, it really limits the amount of data I have to try to figure out that exact root cause or root causes as to why that's contributing to their symptoms. So thorough testing and the test don't guess approach, right? The more you test, the less you guess, the less you test, the more you guess. That's the biggest thing I think is the reason why we have success, and also communication with patients. We try to really be good with communication in between appointments, education, and then at each visit, I bring up the test results and I remind patients where we are in the stage of their protocol in terms of here's what we're doing now. How'd you do with that? How you feeling? And here's the next stage, and here's what we're going to change. And that's why the follow-up visits are really important too. So it keeps people on track. So it's the thoroughness of the testing, understanding the mechanisms, and communication, and just consistency and compliance with the protocol over time, I think is what gets us the best results. And there's always a reason why. Your body has this innate ability to heal, repair, recover. And if we put it in the right environment, which means we take away the things that are negatively affecting your body, and then we put back in the things that you're missing, with that combination, that's usually a really, really good approach.